Hi, and welcome to our video on the heart. This is the AV project for Anatomy Fall 2011 by Mark, Cindy, and Charleslyn. And we're going to be taking you through the second and third portions of Lab 16 and 17 today. I have my little cheat sheet here. So we're going to just basically go down the list and label some parts of the heart model for you guys. So the first thing I'm going to do before I even start labeling any of the parts of the heart, the major parts, is I'm going to take this piece off and show you guys the three different parts, major components of the heart wall. The outermost component of the heart wall is going to be called the epicardium, and that's this little yellow guy right here. The next wall that we encounter after the epicardium is the myocardium. That's this thick wall right here. And the innermost wall is the endocardium, and that's this light pink guy right in here. That's the endocardium. Okay, so I'm going to put the heart back together for a second, and we're going to take a look at it as a whole. First, and this is a little counterintuitive, the base of the heart is actually the top, if you will, of the heart. That's in this area. The apex of the heart is going to be right in this area. Next we have the right atrium and the auricle. On a test, if Professor Wayne puts a pin in the edge of this little pink guy right here, that's going to mean he's asking you to identify the auricle. If it's in the center, he's asking you to identify the atrium. So again, this is the right atrium and right auricle. Similarly, we have on the left side the left atrium. If the pen is in the center, again, he's identifying the atrium. If it's on the edge, it's going to be the left auricle. I also want to point out something that we skipped, which is the thymus, and that's this guy right here. Next we have the right ventricle, which is this whole section right here. And we have, similarly, on the other side, the left ventricle. On this model, it's a little bit difficult to see. It's easier to see on the small heart model, but this section in between the ventricles, I'm just going to take the covers off, is going to be called the interventricular septum. That's going to be much easier to see on the small heart model, but it is, of course, still in the same spot on the large heart model. Next, I'm going to identify the papillary muscles. We have papillary muscles right in here on the right side, and we also have them on the left side. These are papillary muscles. Next, we're going to look at the atrioventricular valves. I'm going to dismantle the heart a little bit to try to get a better view. Again, this is something that you may be able to see a little bit better on the small heart, but because we're working with the big heart and you never know what he's going to put on the test, this is what we're looking at. So, if you can see, we have this is going to be the right atrioventricular valve. This is also known as the tricuspid valve. If you can see where the probe is touching up there, that valve right there, the tricuspid or the right atrioventricular valve. I'm going to turn the heart a little bit. On the left side, we can get the camera up in there. You've got the bicuspid valve, also known as the mitral valve, also known as the left atrioventricular valve. Now, connected to these valves is the chordae tendineae, right along in here, these little cords, and I'll show it to you on the right side as well. This is the chordae tendineae. Those connect the valves to the papillary muscles. Now we have the aortic semilunar valve, again, This one is a little tricky. I'm actually going to turn the heart so maybe we can see. Can you get in there? Can you see that? So we've got, where my probe is sticking, that little white, those little white blobby looking things up there. This is going to be the aortic semilunar valve. And then similarly we have, much easier to see, the pulmonary semilunar valve. I'm going to put the heart back and we're going to take a little wider look. This is what we call the aorta, this whole thing right here. And this is the pulmonary trunk, this blue guy right here. Now if I turn the heart around and we look at the posterior view, coming off the pulmonary trunk, and I'm going to put my fingers there, are the pulmonary arteries. These little guys right here. These are the pulmonary arteries. And I'm going to turn it around once more. Actually, first I'm going to show you. Just kidding. First I'm going to show you the pulmonary veins, which are easier to see when I put the heart back together a little bit. These are the pulmonary veins, where my thumb and forefinger are. And then I'm going to turn it around once more so we can take an anterior view, or a side view, I guess. And here you can see we have the superior vena cava. And then we're going to look at, from the bottom of the heart, as you can see, I'm going to turn it upside down, and this is going to be the inferior vena cava. So again, inferior vena cava, superior vena cava. And the next part of the heart, Mark is going to talk to you guys about. He's going to do part 3 of lab 16 and 17.
Welcome to section 3 of lab 16 and 17. This is the arteries of the heart, the smaller guys. So we're just going to go down the list like Cindy did. So this part, you're going to have to keep your bearings because we're going to take it apart and rotate it quite a bit. So note that this is your front, yes, this is your right and left base apex. So to start, we're going to go over the left and right coronary arteries. So we're going to take it apart. Actually, before we do that, note your aorta, yes? Big, red, giant artery. We're going to take it apart. So this is the aorta. This is that semilunar valve. So this is the right and left coronary arteries. These actually break down even further into 2 other parts as well. The right coronary artery will go into the posterior interventricular artery and the marginal artery. Pardon, this red guy here. So I'm going to rotate it once again. The right coronary artery, if you follow it, it will become the posterior interventricular artery. Interventricular meaning in between your ventricles, and the posterior, once again, the back side of the heart. And then the marginal artery, and pretty much the marginal arteries, this red guy here just supplies blood to the right side of the heart. Now the left coronary artery, this also branches off into 2 things, one being the anterior interventricular artery, right here, interventricular in between but anterior in the front, and the circumflex artery. Circumflex artery is this other branch that goes this way, and here. A little mnemonic we used to remember it is RPM, like you're in your car, revolutions per minute. So R, right, P, posterior, M, marginal, and LAC, this is the word LAC. Left, anterior, circumflex. Yes? Yes. Now to go over some of the bigger veins, the coronary sinus is the big vein that you see. This big blue guy here. and off of the coronary sinus you will find the great cardiac vein and the middle cardiac vein. So once again, let's get oriented. Coronary sinus, and the great cardiac vein is this blue guy that goes and follows the anterior interventricular artery. So right down the front and in the middle is your great cardiac vein. And if you go down back here, once again, posterior interventricular is the middle cardiac vein. Yeah, it's a vein party.